What was meant to be a good news story soon saw the government on the back foot.
I certainly haven't been advised of any claims of internal ramping.
A $3.5 million upgrade of the Women's and Children's Paediatric ED has been partly opened, improving services for families with young children. But the leaking of this image, advising staff at the Royal Adelaide Hospital to familiarise themselves with internal ramping locations, returned the health conversation to familiar territory.
What I'm being told is that as the demand is needed, those beds are being activated. We don't need to internally ramp when we've got beds on standby.
The photo was given to Labor, which says it was taken at the RA last Monday.
This is obviously a concern to people that they see this sort of notice up in the emergency department and that the explanation is that we're going to stop the ramping outside and bring the ramping inside.
It's the first time allegations of internal ramping at the new Royal Adelaide Hospital have emerged after power outlets were removed from hospital corridors to ensure that couldn't happen.
Internal ramping is probably just as detrimental to patient care as external ramping. It was used prior to external ramping, which suggests to me that the internal ramping wasn't successful.
The Health Minister responded, saying the sign simply shows ambulance staff where they can rest inside if ramping occurs. He says the government's reduced ramping by 35% since September.
The fact that January is a bit down because it's a quieter month is no end to the crisis that's happening in our hospitals.
An ailment without an obvious cure. Sarah Tomevska, ABC News, Adelaide.